Hi, my name is Jenn Lowe. Why does the fear of vomiting feel so powerful? For people with emetophobia, even small stomach sensations can trigger anxiety, nausea, intrusive thoughts, and the feeling of losing control can all play a role in maintaining the fear. In this video, I'm going to explain why emetophobia feels so overwhelming and the psychological processes that keep the fear going. So, I'm a counselor in the state of Michigan and North Carolina. I work with children, teenagers, and women with emetophobia and OCD. But I'm a current PhD student and I'm almost finished with my PhD. All that's left is dissertation. And my topic is the lived experiences of women with emetophobia. So, this video, I'm going to focus on some of the research, but that is sort of the point of my dissertation is that we you may not agree with this. You may have emetophobia and be like, no, 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 no. I think more research needs to be done where we specifically ask women about their experience and truly listen. So, little disclaimer, this is sort of like peer-reviewed literature. Um, but I think all women are different and they all have different lived experiences. Okay. One of the most important factors in emetophobia is nausea. People with emetophobia tend to experience nausea more frequently or intensely, especially during periods of anxiety. But something interesting happens here. Many people interpret their nausea as a sign they might vomit soon. In reality, nausea is often a normal physical response to anxiety or stress. The misinterpretation creates a cycle. You notice a stomach sensation, you think it means vomiting is about to happen. Your anxiety increases. Anxiety makes the nausea worse, and the fear grows stronger. The second one in the video is hypervigilance to gastrointestinal cues, stomach sensations. Um, Another important piece is this hypervigilance. Hypervigilance means constantly scanning your body for signs of danger. People with emetophobia often become extremely aware of their stomach sensations. Even small or normal digestive feelings becomes the focus of intense attention. When we focus on bodily sensations this closely, those sensations can often feel stronger and more threatening. This can trigger a negative feedback loop where anxiety, physical symptoms, and catastrophic thoughts all sort of snowball in a loop. Next is disgust sensitivity. Research also shows that people with emetophobia tend to have a higher disgust sensitivity. Disgust sensitivity refers to how strongly someone reacts to feelings of disgust. For individuals with emetophobia, disgust can feel extremely intense and difficult to tolerate. Because vomiting is strongly associated with disgust, many people begin avoiding situations where they might experience that feeling. This avoidance may reduce anxiety in the moment, but over time it can strengthen the fear. Emotional reasoning, another one that's been studied. Emotional reasoning happens when we assume something is dangerous simply because it feels scary or disgusting. For example, someone might think, my stomach feels weird, so something bad must be happening. But feelings are not always accurate indications of danger. When emotions drive our interpretation of events, it can lead to overestimating the risk. Emotional regulation plays a role. Emotional regulation refers to our ability to manage thoughts, feelings, and behaviors when we're stressed or anxious, or other emotions too. But this video, we're focusing on the phobia. Individuals with emetophobia may struggle to regulate emotions when they encounter situations related to vomit, nausea, or illness. This can lead to increased avoidance or safety behaviors that temporarily reduce anxiety but maintain the phobia long term. Fear of losing control. This was one I was excited to read about. I did not know this before. Another factor that appears in the research is something called the locus of control. Interestingly, many people with emetophobia have a strong belief that they should be able to maintain control over bodies and health. But vomiting is an involuntary physical response. The idea of losing control in that moment can feel extremely distressing, which may intensify the fear. Intrusive imagery. Many people with emetophobia also experience intrusive mental images related to vomiting. These are unwanted images that appear in their mind without effort. One of the studies found that 80% of people experience this intrusive imagery. However, it is not just an image, a picture, or a video that plays in their mind. Sounds, physical sensations, smells, and tastes can sort of pop into their mind. Sometimes these images are memories from childhood or adulthood. Other times they are imagined worst case scenario. Last one that fits in there is something called autobiographical memories. So memories also play a powerful role in emetophobia. People with emetophobia often recall vomiting related experiences as extremely distressing. These memories may involve their own illness or seeing someone else become sick. I've mentioned this in other YouTube videos about this topic, but if you were to ask someone without emetophobia, I don't have emetophobia, to remember a childhood memory of someone else being sick at school, I can't think of one. However, people with emetophobia have more of these memories than people without emetophobia. When something in the environment reminds them of these experiences, it can trigger those memories to come up. All right. Again, my name is Jenn Lowe. You can visit my website, jennlowe.care, JENNLOWE.care. I help women, children, teenagers in North Carolina and Michigan, but the IOCDF, the International OCD Foundation, has a search tool on their website where you can find therapists that specialize in different things in your area. So that's always a good resource too. Thanks so much.